be talking this afternoon about type 2 diabetes. I decided to talk about this because I see that there's a lot of millions of Americans that have been diagnosed with type 2 diabetes. And many more are unaware of the issues that they might be having diabetes. This is according to American Diabetes Association. And here I was interested in talking about this speech because I see that diabetes is a disease that has been increasing over the years. This is according to Mayo Clinic. And I've noticed that by educating people locally, we are able to focus on them and being able to tell them what can be done to decrease the disease or how you can slow down the progression. And it can also have an impact on the number of diabetics that are here locally. Therefore, I think it is important for people to have the basic knowledge of what diabetes 2 is. We're going to be talking about the overview, a few points. The overview will consist of a pathophysiology of diabetes, and then we're also going to be talking about the treatment for diabetes 2, and also just giving brief pointers to see how you can slow down or decrease your chances of having diabetes. Let's go ahead and start with what diabetes is. And diabetes, according to Lenny, is what is considered type 2 diabetes is on the onset of the adult. And it's due to the combination of insulin resistance and impaired insulin secretion. Well, basically what this means is the hormone insulin that is produced by the pancreas can't take up the glucose anymore and deliver it to the cells. Therefore, it can't be used to produce energy. As a result, over time, the glucose builds up and destroys the pancreatic cells, and therefore the insulin production and secretion decreases. The signs and symptoms of diabetes, as noted for Lenny, is mostly seen in obese patients, but it can also be seen in people that are of regular weight. And you will see symptoms such as polyuria, which means a lot of urine, polydipsia, increased thirst, and there's also polyphagia, which is excessive eating. And there may be other cases, very few cases, where there will be no symptoms at all. The complications of diabetes would start probably with cardiovascular issues, which would be like high blood pressure and stroke. You will also see neuropathy, which is a disease of the neurons. And also, you will see the retinopathy, which is a disease of the vessels in the retina that leads to blindness after a while. You will also be seeing, which is what is called a nephropathy, which is a disease of the kidneys, and gastroparesis, which is a delayed stomach emptying. You will also see, sadly, a lot of amputations due to the infections and also erectile dysfunction, as noted for Lenny. Now let's talk about treatment for what can be done for diabetes. And here we would also we always start with modifying our health, decreasing a lot of your intake, performing a lot of exercises, losing weight. If your blood can be managed with these measures, then medication can be used depending on how your disease has progressed. This is according to American Diabetes Association. There are probably two ways of medications that can be given. It can be either pills or insulin. And this is actually, you have to be paying attention to the signs and symptoms. Here you can probably see if you're going to be able to take pills depending on the progression of the disease and what your lifestyle is. You are able to treat the levels of blood sugar, and this is basically for the pills. You probably take a routine. You usually do it before meals or after meals, and your health provider will show you how to monitor your glucose levels to know when you would get insulin shots. This is according to Diabetes Association. And lastly, I'm going to be talking about ways to slow down or decrease your chances of having diabetes too. And always, the first thing will be improving your diet, exercise as much as you can, doing some weight loss as well. This is according to WebMD. You will also be paying attention to the signs and symptoms, complications that we talked about earlier, like by seeing, okay, I feel that I may be very thirsty at times, or I experience a lot of needing to be eating constantly. This is noted by WebMD as well. And there's also an early screening that is performed by a lot of clinics anywhere that you may go, and it's called the glucose tolerance test, which consists of drinking a sugary drink, and after 2 hours, your blood is tested for this high levels of glucose, and this is according to WebMD as well. So to conclude, we have talked about the overview of diabetes, what it is, what happens in your body. Also, we talked about the treatments of diabetes too, and we talked about ways to slow down or decrease your chances of having diabetes type 2. I really hope that after hearing this information, you guys feel more knowledgeable about what diabetes is, and it helps you more in life. Thank you.